Welcome to episode 28 of Decatur Dish. My name is Maria Moreau with Atlanta News First, joined by the lovely Dan Whisenhunt with our media partners at Decaturish. This is Decatur Dish. It's a weekly segment we like to do where we catch you up on some of what's been happening out in DeKalb County and talk about some community stories. The biggest one, Dan, that everybody's talking about is the Decab County CEO race, now headed into a runoff.
Yeah, so everyone kind of had that one pegged wrong. Everyone assumed the presumptive frontrunners were Lorraine Cochran Johnson and Steve Bradshaw. Fun fact, no. It turned out to be Larry Johnson and Lorraine Cochran Johnson, and Steve Bradshaw finished a distant third, which was kind of a surprise given how much time Lorraine Cochran Johnson and Steve Bradshaw had spent pummeling each other. Steve Bradshaw has endorsed Larry Johnson in that race, and that's going to move to a runoff on June 18th.
And let's talk about this. So these two candidates now, they're former commissioners, really focused on getting as many voters out on June 18th to put their names on the ballot and give them really the top seat in DeKalb County. Michael Thurmond is very well liked in the county. He's leaving quite a legacy behind it and big shoes to fill, might I add.
Yeah, Mike Thurmond has had a pretty eventful tenure. He ran unopposed 4 years ago. He was definitely a change in tone and an upgrade in the professionalism in the CEO's office. He brought a lot of stability to a county government that frankly was very unstable. So the new CEO, whoever they might be, is going to have a real tall task ahead of them.
Any advice to the candidates as they really look to the next couple weeks?
As far as getting out the vote, I don't think that is above my pay grade. They clearly know something more than I do, because if you had asked me before the election what the runoff was going to be, I would have told you it would have been Steve Bradshaw and Lorraine Cochran Johnson, and I would have been dead wrong. So I'm probably the last person they need to ask for advice.
Fair enough. Hey, let's talk about an issue that's really impacting everybody in DeKalb County, and that is water. The county now addressing a great need for water pipe replacement, and this really is affecting pretty much every resident in the county.
Yes, it affected me twice this year, so that was fun. I think it's a great segue from our last discussion about local elections to talk about the 4.5 or 4.1 billion dollar price tag for replacing all of these water pipes, because this is a great example of why local elections matter. The reason that this hasn't been taken care of is because it's expensive and it's complicated, and local elected officials have kicked the can down the road so many times that these problems have sort of piled up, and now we're at a point where I was without water for a full week twice this year already because of the transmission main on my street. I'm not alone. There are a lot of people in DeKalb County who are affected by this issue, and it's going to take a massive amount of money and political will to do that. One of the ideas is to build a new transmission main, which will carry more of the load so people can experience less disruption when those things do happen. Another suggestion is to upgrade the water treatment plant. A lot of this infrastructure has not been meaningfully upgraded since it was installed in 1940, and the population is much larger now than it was then, and there's new townhomes and new housing developments going up all the time that are putting more strain on it. So the person who becomes the next county CEO that's gonna be the challenge that confronts them really before they take office, but definitely on day one, is how do we get this infrastructure fixed, and how do we build the political will to do that?
You know, time and time again, another issue that remains top of mind for residents is traffic, roadways, and Avondale Estates now looking into traffic calming options to address pedestrian and motorist needs. Talk to me a little bit about what this project is.
Yeah, so Avondale Estates is coming along. They're getting some more downtown development going. They've got more people from out of the city coming in to spend money there, and that is bringing in traffic. And so there's a real discussion going on right now about how do we make Avondale Estates a better city to navigate. We've already talked about the road diet that's going to be on US 278 through the city. That's going to include a lot of sidewalk upgrades and walkability things. Some other ideas that are being tossed around are more stop signs, narrowing the intersections, and this really intriguing idea called a bicycle boulevard, which if I'm reading it correctly, is more or less like the cycle track they're doing in Decatur, which is a dedicated space for bikes. My favorite thing about building sidewalks that are really wide for the cycling community is I walk down them and the cyclists are still on the road. We built like this $1 million sidewalk, and I'm like, but it's so nice, y'all. You could just ride on the thing. But that's fine. They have a right to be on the road too, just like pedestrians. But it is nice to have options if you're a pedestrian, particularly options that don't involve you playing in traffic. So that is what is going on at Avondale Estates. They're starting to have the discussions that Decatur's been having for years because more people are interested in being a part of Avondale now and spending their time there.
Beyond Avondale, I think the city of Atlanta, there's several organizations that are pushing to make the city as a whole more pedestrian friendly, and things like the bicycle boulevard and other conversations being brought up as possible options to encourage that. So of course, there's more information for you on Decaturish.com. Please make sure you check out that article if you wanted to read more about what came out of that conversation. May is Mental Health Awareness Month. Mental health is something that really can impact any of us at any time, and often does more than we like to talk about. And it's anything from anxiety, depression, other more serious mental health crises people find themselves in. And when that happens, a support network and resources are so important. And DeKalb County is now taking a serious look at that, expanding mental health care throughout the county. So, Dan, you actually talked with an organization that is doing just that.
Yeah, we invited Shelby Roche with Claratel Behavioral Services to join us today and talk a little bit more about the crisis center that they're planning to build in DeKalb County. May is Mental Health Awareness Month. It's an important topic to me personally. It's an important topic to a lot of you, I'm sure. And joining us today is Shelby Roche, who is the Director of Crisis Services for Claratel Behavioral Health. Shelby, how are you today?
I'm well, thank you for asking, Dan.
So, Shelby, talk to me a little bit about Claratel. What is Claratel? What does Claratel do in DeKalb County?
Claratel Behavioral Health, most recently known as the Decab Community Service Board, is a public nonprofit organization that provides behavioral health services to individuals in DeKalb County. With over 20 locations, we provide services for mental health, substance abuse, as well as individuals living with developmental disabilities.
And it was previously the DeKalb Community Service Board. You've rebranded a little bit, right?
Yes. At the first quarter of the year, we started rebranding to Claratel Behavioral Health.
So let's talk about the state of mental health services in DeKalb County, because I talk to a lot of people in our cities. There's a lot of frustration around this topic because we have such a problem with finding places for the unhoused community to go. A lot of people, as you know, in the unhoused community are having behavioral health type problems, and there is nowhere for them to go most of the time. So what is the state of play in DeKalb County when it comes to accessing these services?
The challenge currently is the lack of crisis beds. When you think about our current crisis center located in DeKalb County, in Decatur area, we have the largest bed capacity at 36 beds in the region, and the region encompasses 6 counties. So that would be DeKalb, Rockdale, Newton, Gwinnett County, Fulton, and Clayton County. And so when you think about the individuals who are in need of crisis services or a crisis bed so that they can stabilize their current condition and hopefully move on to outpatient programs, that could be very challenging when you think about the amount of beds that we have in this community.
So 36 is the most? Can you elaborate?
No, the largest bed capacity in the largest bed capacity in the state at 36 beds. Due to challenges with staffing, we currently operate with a bed capacity of 30 beds, and this is not including beds at Grady. They currently have about 14 on their crisis stabilization unit, an additional 14 beds as a part of their med psych unit, as well as Viewpoint Health that's located all the way in Gwinnett County. And so it's challenging when you think about the amount of individuals that may present with a behavioral health crisis that are in need of stabilization. Where do they go? Oftentimes they may be steered towards a jail because they may have committed a penal offense in the community, or they're sent to our hospitals that really don't have the capability of treating the individual who is in crisis, and so that they may very well be turned around and discharged shortly after a brief stabilization or waiting period.
How do you even 30 beds just seems way too low for the amount of need that is out there. How do you who determines who gets a bed if you need one?
Well, obviously, at our current crisis center, you have mental health professionals who have to make a determination based on the presenting issues, the individual's current crisis, and what we can reasonably do at that juncture. Anyone coming to our crisis center is in a state of crisis, may not necessarily merit inpatient hospitalization, but we have a responsibility to evaluate them, determine what their current needs are, and make the appropriate determination at that time if they could best be treated on an outpatient basis or if they need to be hospitalized.
So what would you say is the actual need in terms of the number of beds that are needed? Because again, I think 30 just sounds really low compared to what I know just anecdotally the need is. What would be a more appropriate level of beds in crisis centers?
Well, I think it's an ongoing conversation ultimately. I think that it's important that we understand that it's a community effort in terms of awareness about what the need is and also building programs surrounded by the need. And so, as I mentioned earlier, it's an evaluation. It begins with appropriately evaluating the individual by a professional that could determine if there are imminent safety concerns, are there referral sources or other programs that would best be suited for that individual. In terms of the amount of beds, I think that the state is looking at additional options to provide the community with additional crisis beds by way of the development of the Fulton Crisis Center that's in progress now. I know that DeKalb County has also invested in Claratel Behavioral Health by way of allotting about $15 million worth of SPLOST funding towards the construction of a new facility. That new facility would allow us to not only have the 30 beds on the unit, but again, add an additional 10 beds for a total of 16 temporary observation beds. So that would allow us additional beds that would we could kind of evaluate, provide some level of treatment, possibly stabilize the immediate crisis for individuals who are in need. That facility would also add an additional 24 beds, transitional beds for individuals who their immediate crisis has been stabilized, but are in need of additional support before they're released back into the community.
So let's break it down for people. Why would you rather somebody go to a bed at a crisis facility as opposed to the jail or as opposed to Grady Hospital? What services are they getting at these crisis facilities that they can't get at those places?
Well, I think the crisis facility is about really the evaluation component, offering a level of case management, medication management, nursing care, as well as psychiatric care that could overall help the individual who comes to us in that state of crisis. The goal is to kind of provide a well-rounded approach to assisting the individual that also presents with psychosocial stressors that kind of amplify their already existing mental health or substance abuse related issues.
So let's talk about the new facility. There's $15 million in eSPLOS money, and we were talking about this before the show. That's not even really going to be enough to cover the full cost, right? You're still going to need about $10 million to make up that difference.
Absolutely.
Is that correct?
We are still in need of $10 million that we are hoping to help us get to a place where we could break ground on a location. I think at this point, I think that the initial $15 million is a vote of confidence. I think the state is aware of what the need is in the community, and so I'm confident that we will be able to press forward in our endeavor to build a facility that is conducive to promoting behavioral health at a location where it's accessible by people in the community so that they can receive these services.
Why is it so expensive to provide this for the community? You get sticker shock, hearing that as a resident. What is the reason for the cost? What is the most expensive part of doing that?
That's a good question. I think it's a couple of things. I think that the staffing is important. I said we operate with a multidisciplinary team, which includes psychiatrists, advanced practical registered nurses, RNs, LPNs, licensed clinicians, certified peer specialists. So staffing is important. Also, the safety of the individuals in our care. So you have to build a facility that is ligature proof, so that they are in a safe setting. So everything from doors to security windows to chairs, all of those things, door handles, all those things have to be considered in the construction of a facility that's going to house people while they're receiving treatment, but also maintaining their safety.
Let's talk about the state of play of mental health in Georgia, because there's a lot more awareness now than maybe there was 10 years ago, primarily because whenever you look at these lists of states and where they rank on mental health care, Georgia always seems to be dead last. And I think it's getting better, but there's still a long way to go. So what are some of the recent developments in that situation in terms of providing mental health in Georgia? And do you think they've been helpful?
I do think they've been helpful. Most recently, the Mental Health Parity Act, which is mandating insurance companies to provide mental health services, behavioral health services on par with individuals that present with physical conditions. I think that that's strides in that area. Additional legislation has also created programs where we integrate behavioral health into primary care clinics. Expanded education for our law enforcement first responders with regards to mental health services. Most recently in Senate Bill 403 that really provided the framework for individuals for programs, co-responder programs where we partner a law enforcement officer with a mental health professional to respond to crisis calls in the community. So there has definitely been some leeway in those areas in terms of not only integrating ourselves within the community, education. I think that we still have some area to improve on, particularly in terms of sustained funding for these mental health programs, as well as programs geared towards reducing the stigma to behavioral health services.
I think one thing I keep coming back to when I hear this conversation is we're talking about creating a crisis center. What can be done to help people before they get to a crisis point? Because a lot of times when people are in a crisis center, it's because they have an untreated mental illness. Well, what can we do as a state to make it easier for people to get treatment before it becomes a crisis?
I think education is key. I think having conversations about what is a crisis, what are you experiencing and feeling, reducing the stigma related to behavioral health disorders. It's important that we understand that behavioral health, mental health, substance abuse related issues have the way of touching everyone that we know in some capacity, more or less. I think that as a community, if we make ourselves more aware of these issues, we could make people feel more comfortable with asking for help when in need, prior to it becoming a situation where it's dire for them to need a crisis bed. I think that would be very important. Also, expanding services like community outreach for us to kind of be able to go out into the community. Oftentimes, a lot of these individuals that receive care may not have the means to access or be transported to a behavioral health facility for outpatient or inpatient treatment. And so creating programs where we could actually physically go out into the community and meet people where they are, I think that would be help as well.
Talk to me a little bit about how you see the media covering mental health, because it's something I try to be cognizant of in my own work, and I know there's greater awareness among my other colleagues in the media. What is the media doing well, and where does the media need to improve in terms of how they cover these issues?
I think there's been significant strides over the past couple of years when we think about where we are as a society in terms of being post-pandemic. I think that COVID and having to deal with the challenges that COVID presented in terms of our access not only to services, but accessing people. It's changed the way that we talk about mental health services, people dealing with depression, anxiety, and other severe and persistent mental illness. I think that's a first step. I think the media kind of shows it in news stations, in television programming, normalizing the idea that it's okay to ask for help. I think that we continue to add that discourse to our education system. I think that is an important area in which we need to focus put our focus in, simply because children need to normalize the idea of that there's some people who have challenges. And what do those challenges mean? And if you encounter someone with challenges or you experience challenges, how could you access help?
Shelby, thank you so much for the important work that you and Claratel are doing, and thank you so much for taking time to talk to us about mental health here in DeKalb County. This is the Decatur Dish Show. I'm your host, editor and publisher Dan Whisenhunt. We tape here on ANF First, but we stream here rather on ANF Plus every Tuesday at 12:30. I would just add, if you are a person who has mental health struggles, I'm one of those people. It's important to understand that there are plenty of us that are out in the community who are thriving, who are flourishing. A big part of that is that we knew to go get help when we needed it. And that is something that I would encourage everyone to do. If you've got an ability to go get treatment, please take care of that. It's important to you. It's important to your family. If you want to find out more information about what we do over at Decaturish, you can visit our main website at Decaturish.com. If you want to get informed about the local elections, please go to DecaturishVotes.com. That's our main elections website. If you want to support Decaturish, please visit SupportYourLocalNews.com and become a paying supporter. We really need your help. And if you want to support our media partners at Atlanta News First Plus, please go and download the Atlanta News First Plus app. You can get episodes of this show and episodes and content from our great media partners at Atlanta News First. And with that, we're going to wrap it up for today, but we'll see you next Tuesday at 12:30. Bye-bye, everybody.
Thank you.